If you've been told you're too old for dental implants, this video is for you because age is not what determines whether implants work. Age should never immediately disqualify you. After nearly 25 years and thousands of implant cases, I've placed implants in patients well into their 80s, and anyone who says you can't get implants just because of your age is someone you may not want to trust with your teeth anymore. By the end of this video, you'll know exactly what a true assessment involves and how to find out whether you're a candidate for implants. Point 1. The question deserves a real answer. Most people watching this are here for one or two reasons. Either a dentist has told them implants weren't possible and they're not sure whether to believe it, or they're doing the maths in their own head, wondering whether it's worth the cost, the recovery, and the time at this stage of their life. Both of those are completely reasonable places to be. But here's what I see consistently after 25 years of having this conversation. The patients who were told no by a dentist were almost never given a proper reason. No scan, no health assessment, just an age as a verdict. And the patients doing the maths in their own head were usually calculating against the wrong thing. They're asking, how many years have they got left and if it's worth the cost? But what they should be really asking, how many years do they want to spend not being able to eat properly, or avoiding photographs, or worrying about their teeth every single day? I've had patients in their late 70s tell me they wish they'd done this 10 years earlier, and that getting their smile back along with their bite was worth way more than what they paid for the procedure itself. So the question of whether implants are right for you at your age deserves a real answer. And unfortunately, if you've been to a less specialized clinic, you may have been prematurely dismissed. Point 2. Age and health are not the same thing. At some point, age became shorthand for health. That's the problem. When a dentist tells a 72-year-old that implants are not suitable for them, they're usually making an assumption, not an assessment. There's a big difference between those two things. I've treated 50-year-olds with serious bone loss who were genuinely not suitable for implants at that time. I've treated 75-year-olds with healthy gums, solid bone, and no medical complications. And they went through the procedure without any issue, and they've been eating whatever they want ever since. Their age told me absolutely nothing useful in either direction. And here's why that matters. When age becomes the filter, nobody has to do the actual work. The dentist doesn't have to run a proper assessment. The patient doesn't have to ask the harder questions. Everyone walks away from the conversation that should have really happened. And the patient goes home thinking the answer was no, when the real answer is nobody actually looked. Age tells you how long someone has been alive. Health tells you what their body can do right now. Those are two completely different questions, and they produce two completely different answers. A proper implant assessment is built around the health question: bone density, gum condition, medical history. Those two things change from person to person, regardless of age. A 70-year-old who's looked after their health can have a better clinical picture than a 55-year-old who hasn't. So if you were given a verdict based on your age alone, without a scan, without a gum assessment, without a proper medical conversation, you weren't assessed, you were dismissed. Point 3 is going to show you exactly what a real assessment looks at and how to get a sense of where you stand before you walk into any consultation. Point 3, what a real assessment actually looks at. A proper implant assessment comes down to 3 things: bone, gums, and your general health. Let me walk you through each one so you know exactly what you're dealing with. The bone. The implant goes into your jawbone and it acts like an artificial root. And for that to work, there needs to be enough bone there to hold it, and the bone needs to be dense enough to fuse with the implant over time. Now, the bone does change as we get older, but the main reason adults lose jawbone is tooth loss and gum disease. Both of those are clinical problems, not age problems. I've seen significant bone loss in patients in their 40s, and I've seen excellent bone in patients in their 70s. And the only way to properly assess the bone is with a 3D scan, not a standard X-ray. A 3D scan shows the bone volume and the density in detail. Without one, any verdict on whether you have enough bone is just a guess. So ask yourself this: have you been told you have bone loss? Has any dentist ever mentioned that bone levels around your teeth are low? If that's yes, it's worth investigating properly. It doesn't automatically rule you out of implants, but it means the bone picture needs a closer look before anyone makes a true recommendation. The gums. Implants placed into a mouth with active gum disease fail at a much higher rate. Gum disease, it's a bacterial infection that breaks down the bone and the tissue around your teeth. If it's active when an implant goes in, that same process attacks the implant. And the important thing to understand is that gum disease is often silent. No pain, sometimes you get no bleeding. You can have it progressing for years without knowing. A proper gum assessment measures the depths of the pockets around every tooth, and that tells you whether the disease is actually active. A visual check is simply not good enough. Ask yourself this: have your gums bled regularly when you brush? Have you been told you have gum disease at any point, even years ago? If yes, that needs to be properly assessed and stabilized before implants go in. It's treatable, but it needs to be on the table. General health. Certain medical conditions and certain medications can affect how you heal after the surgery. Uncontrolled diabetes is the main one. Some blood thinners and bone medications are worth a conversation too. These aren't automatic disqualifiers, but they need to be declared and discussed. This is the area most closely linked to age in people's minds. And yes, the older we get, the more likely you are to be managing something. But managing a condition is not the same as being unsuitable. Most of my older patients are on some sort of medication. Most of them are still perfectly suitable for implants once we've had a proper conversation about their health. Ask yourself this: are you managing any significant health conditions? Are you on any long-term medications? If yes, bring that list to your consultation. A good implant dentist will go through it with you and tell you plainly whether anything on it changes the picture. If you went through those 3 areas and nothing alarming came up, you're likely to be in better shape than you think. If something did come up, that doesn't mean the answer is still no. It means the assessment needs to be thorough, which is exactly what point 4 is going to cover. Point 4, age is not the reason for most people watching this video. Age is not the reason you can't get implants. If your bone is in reasonable shape, your gums are healthy or can be stabilized, and your general health does not present a specific surgical risk, you're likely to be suitable. I've seen this play out thousands of times. The patients I've had to turn away were turned away because of bone loss that had gone beyond what grafting could reliably address, or active gum disease had never been treated, or a medical situation that made surgery genuinely unsafe. And not one of them was turned away simply because of how old they were. Now, there are situations where age-related changes do affect the picture. Bone density does reduce over time in some patients, and healing can take longer. Certain health conditions become more common as we get older, and some of them do require extra planning. A good implant dentist will tell you all of that clearly and factor it into the plan. That's not a reason to avoid the conversation. That's the reason to have it with someone who knows what they're doing. One of my patients, Diana, she'd spent years cycling through failing crowns and an abscess that kept coming back. She was nervous. She'd put it off for a long time, and we removed the problem tooth, built up the bone, and placed an implant. And do you know what she told me afterwards? There was no pain, and it was all very manageable. And she felt like she was finally in great hands. Diana wasn't too old for any of it. She was one proper assessment away from a completely different outcome. So the honest answer is yes, an implant is possible for most people watching this, but yes, a proper assessment behind it has to be done. And point 5 is going to give you exactly what to say at your next consultation to make sure you get that assessment rather than another dismissal. Point 5, what to do now. Walking into a consultation armed with the right question changes everything. A dentist who understands implants properly will answer it without hesitation. And a dentist who's been using age as a shortcut will not know what to say. Now, think of it like taking your car into a mechanic. If you walk in and say, "My car's making a noise," you'll get a guess and a bill. If you walk in saying, "There's a bit of a grinding noise when I brake at low speed," you're likely to get a diagnosis. The more specific your question, the harder it is to fob you off with a vague answer. And the same principle applies here. A vague question gets a vague answer. The right question gets a clinical response. And a clinical response tells you immediately whether the person across from you actually knows what they're talking about. So here's exactly what to do before your next consultation. Write this down tonight. The question to ask, based on my bone levels, my gum health, and my medical history, am I suitable for dental implants? And what a good answer sounds like, a specific response that addresses each of those things separately. They might say, "Your bone looks good on the scan, your gums need some treatment first," or that a particular medication needs to be checked with your GP. And what an evasion sounds like. At your age, we would normally recommend, or implants are quite involved for someone in your situation. And anything that references your age rather than your clinical picture is not an answer to the question you asked. If you get an evasion, ask for a referral to a periodontist or an implant specialist, someone whose entire practice is built around complex cases, and the conversation will be completely different. Most people who've been told they're too old for implants have never actually had a proper assessment. They just had a conversation. And now you know the difference between an assumption and an assessment. You know what a real evaluation looks at, and you know exactly what to say to find out whether you're a candidate based on your actual clinical picture and not your age. The oldest patient I've placed implants in was in his early 90s, and he spent years thinking the door was closed, whilst it was wide open all the time. If this video changed how you think about this, the next one is the one to watch. It's the one I made about the mistake that happens before implant surgery even starts. Most people never think to check it. It's on the screen right now. Check it, and I'll see you there.